And joining me now is NBC's chief White House correspondent, Kristen Welker. She is, of course, also the co-anchor of Weekend Today. Kristen, thanks for being here. What have we learned just in the last few minutes about the state of this investigation and what America now knows about the possible origins of the virus?
Well, we're just getting a new statement from the Assistant Director of National Intelligence. Let me just read you some of this, Casey, and then we'll do some analysis on the other side. This statement says the U.S. intelligence community does not know exactly where, when, or how the COVID-19 virus was transmitted initially, but has coalesced around two likely scenarios. This, of course, echoes what we heard from President Biden yesterday. Either it emerged naturally from human contact with infected animals, or it was a laboratory accident. So that just reaffirms what we've heard from President Biden. Of course, he has ordered this 90-day review, Casey, to try to get to the bottom of where the intelligence community believes this virus did, in fact, occur. I spoke to a senior administration official just a short time ago who shed some light on the timing of all of this. There have been a lot of questions. Why now is the president lighting a fire under this investigation? Why not do it on his first day in office? I was told, according to sources familiar with the matter, that the president received his PDB, his presidential brief, several weeks ago, which had an update to the investigation that he had ordered in March. Remember, he did order a review of the origins. It was what he saw in that PDB and what he was briefed on that led him to then ask that that information be declassified to the extent possible. While that was happening, yesterday, or a few days ago, I should say, China came out and said it was not going to participate in phase 2 of the World Health Organization's investigation into the exact origins of COVID-19. And so all of these events, I am told, coalesced to form that statement that we saw yesterday. President Biden saying that he wants to get to the bottom of the origins with these two theories emerging. Casey.
All right, Kristen Welker, thanks very much for that breaking news. And joining me now is Dr. Zeke Emanuel, the Vice Provost of Global Initiatives at the University of Pennsylvania. He was a member of Biden's Transition COVID-19 Advisory Board. Dr. Emanuel, thank you so much for being with us today. And I actually want to add, there's another line in the statement that Kristen just read from. Again, this is from the ODNI, the Office of the Director of National Intelligence. And they say that currently the majority of the elements within the intelligence community don't think that there's sufficient evidence to assess whether it's more likely that it was a natural occurrence or that it was a laboratory accident. What is your sense, based on this information, of how this happened?
Look, I think everyone's being honest. We don't know. And one of the reasons we don't know is China hasn't been completely transparent with all the data, including the blood samples from the people in the Wuhan Institute who got sick early in November. We need all the data and we need transparency, and we do need the Chinese to participate because, you know, the real issue is not how did this happen? The real issue is how do we protect ourselves from the next pandemic, and how do we have a kind of early warning system for whether it's naturally occurring or a laboratory leak. We still need to protect ourselves so we don't have 3, 4, 5, 10 million people die unnecessarily.
So, I mean, what assurances do we possibly have that the Chinese would be willing to cooperate with us on some sort of probe here? I mean, they have not shown a willingness to cooperate or let people in. The WHO was blocked. We had a hard time getting people on the ground there in the beginning. Why would that change now?
Well, I think that you have to take this in the global conflict between the United States and China perspective. That's how this is playing out. It's really a battle about soft power and influence related to other countries. And, you know, the Chinese have said that, look, they put out the sequence of the virus early so that people could begin working on vaccines. They've been sharing vaccines. This is all part of a global struggle between the United States and China, where COVID is a major issue. And so I think that's part of what's going on. And, you know, putting pressure on them, not just the United States, but other countries, is going to be important. That we really all need to know. And they did participate in the first phase of the WHO proposal, but they didn't release all of the data, and the investigators didn't have full access. And that really has to be part of what happens going forward.
So you were part of the Biden transition team. Obviously, the thinking on this has evolved significantly, it seems, in the 6 months since we've been in the Biden presidency. How much were you worried about the origins of this at the time when you were preparing to come in? And how did you change the way the administration was going to approach it compared to what the Trump team was doing?
Well, I think, again, the watchword was let science rule here, and let's the scientists try to get to the bottom of this with help of the intelligence community that would give evidence and information to the scientists. That was the main goal. I would say on the transition, again, our focus was on dealing with the current crisis and making sure that the vaccine rollout was going to happen, that we had good surveillance for any variants, and anticipating the post-COVID pandemic. How are we going to prepare to prevent and minimize the risk from a next pandemic? The origins of this virus were less the focus of what we were doing. There was a general agreement that we would need a study of this, and we would want an independent study by the WHO and the United States intelligence community. Yeah. But, again, that is a kind of secondary question. The real primary question is a public health question is going forward. What are we going to do to prevent anything like this from happening, whether it's a laboratory leak or a natural occurrence?
Fair enough. All right, Dr. Zeke Emanuel, thanks very much for being with us today. Really appreciate it.
My pleasure.